Clinical trials are used for testing medications. For example, patients are distributed at random to one of two treatments by investigators. This ensures that the two groups are identical in everything except the treatment, and therefore, all observed differences will be causally attributed only to the effects of the treatment and not to any other factor. Can you imagine a large trial conducted to test an overall food pattern instead of a medication? In such a trial, participants would not be allowed to eat what they'd wanted, but instead what the investigators assigned to them at random. That trial would ideally last several years. Difficult, right? Has this ever been done? Yes, it was Predimed. In Predimed, investigators allocated 7,447 participants to 3 groups, 2 of which were advised to follow the Mediterranean diet. The 2 Mediterranean diets reduced the risk of heart attacks, strokes, and cardiovascular deaths by 30%. Predimed was published in 2013. In 2017, the Predimed Steering Committee identified 2 issues. First, the enrollment of a previous participant's spouse without randomization. This means members of the same household as randomized participants were invited to participate in the study, and to avoid assigning different diets to members of the same household, they were allocated to the same intervention group as their spouses. This was considered to be the best approach to achieve dietary changes in the household. Second, Predimed carried out their research at 11 study sites, which encompassed 169 clinics. At one of these 11 sites, Site D, the treatment was not carried out as expected. There were 14 clinics within Site D, but at 11 of these 14 clinics, instead of allocating each participant individually, all the participants within the clinic were assigned the same intervention treatment. Some clinics were assigned olive oil, others nuts, and others as controls to avoid problems with participant compliance with the diets. The steering committee was never informed of this action. The trial was carried out at 11 sites in Spain with 7,447 participants. However, the sum of these 2 imperfections, including second members of the same household and all of Site D, only affected 14% or 1,042 of the participants in Predimed.
To address the departures from a strict individual randomization in a small subset of participants who were allocated in clusters, that is, families or small clinics, instead of being individually allocated, the Predimed investigators applied new appropriate statistical methods to account for this potential clustering effect and minor imbalances in the compared groups. This is the result of the new main analysis that included all participants. In this analysis, a robust variance estimator accounting for intercluster correlations and propensity scores were used. These methods were accepted as the main analysis by the statistical editors of the New England Journal of Medicine, and they successfully underwent the full process of peer review by external reviewers appointed by the journal, the results remaining basically intact, with minimal changes only in the second decimal place and of very small size. This was the main analysis. Other analyses conducted after doing some exclusions or other issues were only secondary or ancillary analysis.
After excluding those participants who had not been assigned randomly, second household members, and all of Site D, the results did not suffer any meaningful changes. Therefore, it was the Predimed investigators who took the initiative, and after many months of work with the editors, they had added many new statistical analyses and requested to replace the original publication with a new article, providing all of these details. Considering the need to inform the readers of these characteristics and to report the many new statistical analyses which time after time have demonstrated that there are no modifications of the results nor conclusions, the New England Journal of Medicine has replaced the original article with a new version. In this way, the research does not lose any reputation, and the readers learn about these new details that before were unknown.